It's a COVID summer. We are in a summer wave of COVID-19. So the virus is a possible culprit if you have a cough or fever. We collected detailed data differently than during the pandemic's peak, but the wave started to build around May. I know so many people who have recently had COVID, says Prof. Peter Openshaw from Imperial College London. Around 3,000 people in hospital are now testing positive for COVID, around twice the figure for early April. The infection isn't necessarily why they have been admitted, but it is one way of gauging whether we are in a wave. There is a very significant rise. COVID hasn't yet turned into a winter virus, and we can be very confident in saying that, says Prof. Openshaw. This seems to be driven by the flirt variants of the virus, which are more transmissible and may cause more severe illness, and pubs rammed with football fans may have helped the virus too. The virus is still capable of causing an unpleasant infection. While we are no longer taking emergency measures to keep it in check, we are giving the most vulnerable 2 doses of vaccine a year because of the threat it can pose. Disrupted seasons. You would expect to get most respiratory infections, coughs, colds, and flu during winter. The cooler weather, spending more time indoors, and keeping the windows shut all give respiratory viruses an edge at this time of year. One argument is that the pandemic restrictions have disrupted the usual pattern. Flu almost disappeared during some winter lockdowns, and things haven't quite returned to normal. For instance, the closure of schools and reduced social interactions may have led to a decrease in the spread of seasonal infections. It seemed to throw seasonality, particularly cold viruses, out of kilter, so they were cropping up at weird times, and I don't think things have settled down at the minute. There's a little bit of catching up to do, says Prof. Ball. The idea goes that even if you are catching exactly the same number of infections in a year, it might feel like you're sick all the time. These sorts of things are extending that period of when we're feeling groggy, and therefore we're going to think, I'm ill more than I used to be, suggests Prof. Ball. Whooping cough. We also saw the resurgence of whooping cough, also known as the 100-day cough or pertussis, in 2024. This is a concerning trend, as whooping cough can be severe, especially in infants and young children. There is an outbreak of bacterial infection every 3 to 5 years, but the last one was in 2016. There probably should have been an outbreak during the peak pandemic years. The UK Health Security Agency warns the impact of the pandemic also means there is reduced immunity in the population. The symptoms are similar to a cold, a runny nose and sore throat that evolve into bouts of coughing that can last a long time, hence the 100-day nickname. Anyone can catch whooping cough, but it is generally mild in adults. The problem is they can pass it on to highly vulnerable babies. 9 have died this year from the disease. It is why newborn and pregnancy vaccines for whooping cough, which passes protective antibodies onto the baby while still in the womb, are so important. But vaccination rates dropped. Lower vaccination levels mean getting sick from preventable diseases. Take whooping cough. 72.6% of pregnant women chose to have the vaccine in March 2017, compared to 58.9% in March 2024. However, declining uptake is a broader pattern across childhood vaccines. The UK reached the 95% target for children getting the measles, mumps, and rubella vaccine for the first time in 2017, but it is now down to 92.5%. We've got more susceptible people, and that pushes the ability of these infections to thrive, which is why we've had warnings about measles outbreaks, says Prof. Sheena Cruikshank from the University of Manchester. There have been measles outbreaks in Birmingham and London. The initial symptoms are like a cold, fever, runny nose, cough before a rash appears. It has led experts to call for an urgent reversal of declining vaccination figures, as we are reaching a tipping point of children dying or becoming seriously ill from preventable diseases, more vulnerable to infection. Another idea is that even if the bugs circulating did not change, we would have become more susceptible to them because our overall health is ropey after austerity, a pandemic, and a cost of living crisis. Around 2 million people report having long-term COVID-19. There has been a surge in the number of people with long-term health problems, and the NHS has a mammoth waiting list. Prof. Cruikshank says stress makes the immune system less able to function, and that sedentary lifestyles and bad diets cause metabolic inflammation. This is where our immune system has gotten out of balance, and this makes us less able to deal effectively with threats, she says. Many people are malnourished and miss out on key nutrients that are really important for their immune systems. So infections that our bodies may have quickly cleared in the past may be causing more intense symptoms now. Hay fever. If you're feeling grody with a runny nose, itchy throat, and bouts of sneezing, your immune system may be reacting to pollen rather than an infection. If you're unlucky enough like me to have hay fever, that's not going to make you feel particularly wonderful either, she says. The Met Office says climate change has the potential to affect hay fever by increasing the pollen season and the intensity of the pollen, essentially making hay fever worse and lasting longer. This is a long-term trend, but Prof. Cruikshank says this could explain feeling a little bit worse this summer. Summer colds are nothing new. The phrase summer cold was not coined in 2024. Prof. Ball says that as well as the other factors above, we may be more on edge about coughs and colds after developing a heightened response due to the pandemic. In 2019, nobody thought, "Is that COVID?" when a colleague had a raking cough, or "Do I need to buy a COVID test?" when feeling ropey ahead of a holiday flight or visiting elderly relatives. People are just a little bit more aware of sniffles and things that maybe pre-COVID they just got on with life, says Prof. Ball. COVID is still COVID-19, but we don't need to fret so much about an old-fashioned summer sniffle.